Hello everyone, I am Molshri from Beautiful Spotless Skin team. I'm sure all of you must be keeping in good health. To look beautiful and smart at all times is a quest of humans right from the beginning of the civilization. Few of the common conditions affecting the look and feel of a person are acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern, especially for women in their 20s. However, it would be wrong to say that men don't suffer from acne either. To a lot of people, acne is also known as blemishes, blackheads, whiteheads, pimples, or cysts. It is most common during puberty and adolescence, and according to a recent data, almost 80% of the people in the age group of 11 to 30 years have acne breakouts at least once in their lives. Although acne most commonly does not have any serious health concern, it can be quite distressing for the sufferer. The faster the issue is diagnosed, more effectively can it be treated. Thus, knowing about acne management from an expert is quite essential. For this, today we have with us Dr. Shehla Agrawal, a consultant dermatologist from Delhi, live with us to educate us more on acne management. Dr. Shehla is a director and consultant dermatologist at Mehak, the Derma and Surgery Clinic, South Delhi. She has done her graduation and post graduation from Maulana Azad Medical College, New Delhi. Dr. Shehla is a pioneer in the industry for the last 25 years, having expertise in dermatology, cosmetology, cosmetic surgery, anti aging, peels, lasers, and other skin rejuvenating treatments. With her expertise on today's topic, Dr. Shehla will enlighten us on management of acne. So, Doctor, we welcome you to this live interaction.
Thank you so much. And acne, as you said, it's not only a female problem. Males suffer from it equally. And actually, it affects everybody's self-esteem. So that's why though it might not be a disease, but it definitely becomes a problem.
You said it right away. Yeah, it cannot be, it's not a disease, but it can quite affect your self esteem. So, let's start with that. What are the causes of acne, Doctor?
Acne is an inflammation and infection of the sebaceous gland which are present on the body, and the area of acne distribution is face, V of upper chest, upper arm, and back. So these are the areas where the acne producing glands are present, and they are the ones which, when there is an infection and inflammation, I always say two things, because acne is not only an infection. Sometimes we treat the infection, but the inflammation happens. You know, डिफरेंस है, बिकॉज लोगों को लगता है कि ये एक तरह का इन्फेक्शन है, ये इन्फेक्शन नहीं है. कई बार जब when you are doing like this, when you are touching your face again and again, when there is pollution, इन्फेक्शन नहीं होगा, लेकिन इन्फ्लेमेशन, द ग्लैंड्स विल बिकम swollen, the glands will become irritated, and acne will pop up. So whether you have an infection or not, the acne will be there.
Yes, absolutely. As you said, that it is an infection as well as an inflammation.
Yeah.
Uh, we have this in for the general information. Like generally, we know that heat is quite a big factor. So is that true? कि heat से भी acne breakouts हो सकते हैं?
हाँ, देखो, acne, we have to understand. I didn't answer the last question in a long way because otherwise it becomes monotonous. The acne, it starts appearing once you attain puberty. The sebaceous gland which are producing sebum are quiescent. They don't do anything till you are a child. Once the puberty hits, which is around 13 to 14, the hormones, the testosterone, estrogen start acting on these glands, and they start producing sebum, which can get infected and inflamed. So these are the normal. As it is said that acne is not a pathology, it's a physiology. Means, again, it's not a disease, it's part of growing up. So till you are 19, 20, it will be part of your growing up. So if a 16-year-old comes to us, we say, oh, it's part of it, but you have to take care of it, because if you don't take care of acne, they will leave marks and scars which are very difficult to treat. So this is normal hormonal acne. लेकिन ऐसा नहीं होता कि you turn 20 and suddenly overnight the acne disappear. So if the acne continues into the adult acne realm, which is in your 20s, then we look at various causes, which can be heat, as you rightly said, which can be dehydration. And actually, as we talk ahead, you'll realize even winters is the time where the acne sometimes increase, because if you are not moisturizing enough, the body sends a signal that there is dryness. And that dryness, the signal results in production of more sebum also. So weather-wise, yes, but hormonal acne is more important. Another factor which is very common in cities is pollution.
Of course, yeah. And in the 21st century, pollution is the cause of most of the things we have around, of course.
So we have to learn. The textbooks are rewritten.
Yeah, of course.
Yeah.
I would like to inform all the viewers, since this is a live interaction, Dr. Shehla is live with us. आपके जो भी क्वेश्चन है, queries हैं, you can just put it in the comment box, and Dr. Shehla will be happy to answer all those doubts and queries. Doctor, as you said that winters में due to the lack of moisturization, कभी-कभी acne ज़्यादा बढ़ जाता है due to the increased production of sebum. That was going to be my next question. Like, is acne specific to any particular season, or does it occur throughout the year? Does it have anything to do with the season?
Once the adult acne is there, it will happen. Patients get frustrated. Doc, you were saying winters, now you're saying summers, then the humidity comes, but the care has to change. In summers, you will use a different face wash, different gel-based cream. In winters, but you have to use something. You cannot be like, a bare face, you're not washing, you're not applying cream. That will not happen in winters, because people who have acne, they normally have oily skin. So they have that, mind make wo hota hai ki I have oily skin, I don't need moisturizers. But even for acne people, you have to use oil-free moisturizer. Oil-free moisturizer will moisturize your skin cells but will not stimulate the gland cells. So ये जरूरत जो है एक moisturize करने की, वो हर आदमी की जरूरत है. Otherwise, in winters also, as I said, the signal goes that there is dryness, and then the glands also produce oil. Yeah. And in winters, the problem is that in summers, at least we bathe frequently and we remove the clothes. We are sitting in winters because we are wearing all these clothes, so all the sweat, we are still sweating even in winters. So that keeps on getting accumulated. And I know people who don't change their, warm inner garments for a longer time. So that leads to more acne at the back. So winter or summer, if you are taking the right care, you will not be troubled by acne. But the moment you default, acne will make their appearance.
Of course. A very important piece of information which I would like to highlight again is that moisturization is very important. As doctor said that even for oily skin people, for acne prone skin, an oil-free moisturizer is increasing. It's very important.
Very important. Very important.
Yes. So, since there are different causes to acne, there are different, different factors to it. Are there some ways that we can prevent these acne breakouts? Like how to prevent the breakout?
The idea is that we go by the way that, first of all, you reduce the production of sebum which is being produced. Secondly, what is being produced is present on your face, so you remove it so that it does not cause any irritation. If you go step by step, once you have removed it, if there is any infection, then you remove that infection. So the most important therapy is face wash. Somehow or the other, even if you are washing your face only once, I'm not even saying 3 times a day, 4 times a day, when you reach home from outside, whether it can be school, college, work, just wash your face with a good face wash. In summers, it can be a foaming face wash with salicylic acid. People know all these names. These days, everybody is very aware. Only thing they don't know is that it does not work in winters. So in winters, so in winters, you have to go to a cleanser-based lotion because you cannot dry your skin further. So if you are using a face wash, you are treating the cause of acne. If you are drinking enough water, then you are diluting the secretions which are being produced by the sebaceous gland. So the thinner the secretion, the less chances of it getting infected. So you do that. If there is any infection, you have anti-acne creams. Clindamycin is something which everybody should know, because at some age or the other, and women just before their periods, you will get an acne or two, which is a good sign. Your hormones are working right. So
That
when
is a
you reach
very
menopausal age, then you realize the importance of it.
that is a very positive way to look at acne
I know.
breakouts too. Yeah,
So just apply the clindamycin cream on the acne part of it. If the acne is leaving marks, then apply the serums which are there to reduce the marks. So at every stage, you have to identify what you need.
of course. So these were some of the few ways that doctor suggested can be used to prevent acne breakouts. A very judicial use of face wash and very quite an awareness about is number one, of course. And then we have, of course, moisturization and particular serums and whatnot. As doctor, you said that it starts in puberty and there are some hormonal factors related to it, and then it continues in adulthood as well. What about old age? Does acne occur in old age too?
नहीं, ज़्यादा नहीं होता, because the sebaceous glands are less and the skin is very, very dry. So
Yeah.
as I said, if the skin is, as we all age, whatever, whether you had oily skin, dry skin, combination skin, we all are going to get dry. So
Yeah.
if you don't treat that dryness, so you might get, but we don't call them acne at that age. We'll more call it folliculitis or inflammation. The acne is reserved till 45, 50, and after that it becomes that you have to need to moisturize more. So there is no clinical definition where I say, okay, now this is not acne. We see that the sebaceous glands stop producing that much oil. But yes, because if you're not moisturizing, then it might rebound on you and you might get 1 or 2 lesions. But there we will prescribe an antibiotic cream. The prescription differs then. There I will prescribe an antibiotic cream, because what happens is the sebaceous gland are the house of Propionobacterium acnes, which is the acne producing bacteria. There are multiple fungus and bacteria which are part of our skin. They are part of our flora. So you don't have to make them disappear, because they have an important function in the body. So you don't want to make them zero also, because if you make the bacteria zero, the fungus will increase. So, but it has to be contained. So in older age, I will prescribe an antibiotic cream, though in younger age, I'll be more. I'm sorry, these phones don't stop, and it's a fraud call. All the day I'm getting these fraud calls. I don't know what to do with it. So in old age, no, but if you're getting more of it, there is no harm in showing, and sometimes some medicines.
Yeah.
Sometimes some medicines, because by the time we reach 50, we are taking an antihypertensive. People are taking anti-cholesterol medicines also. Anti-cholesterol medicines are something which make your skin extremely dry. So if your skin becomes dry, then rebound by it. Sometimes people don't realize what you are taking is affecting you, every organ of your body. So if you are having anything, then you should, when you come to me, even as a dermatologist, you should come with the whole prescription so that I can analyze what is working. Another problem which I see, Mochpri, is that people become very diet conscious and they stop eating all the oils and everything. So there is no vitamin A or vitamin E going in old age. That becomes another problem, because then the glands try to produce more oil because you're not getting any oil. So all these things become very, very important.
So that is an important point, an important sufficient intake of vitamin A and E.
Exactly.
And yeah, as humans, we have the tendency to be very much concerned about, sticking to the young years of our lives. But now that you've mentioned it, old age is something we can positively look forward to, because there will be no acne.
It's part of life.
It's part of life. Yes, as we are having this really interesting and jovial interaction with us, Dr. Shehla, we have some questions from our viewers too. Deepak Sharma has asked, is acne problem also due to hormonal imbalance and common in both men and women?
Yeah.
So,
Hormonal imbalance means, as I said, that till puberty, till you are in your 13 to 14, till you reach 20, that is not called hormonal imbalance. That's caused the new balance of hormones which you are going to achieve. But that should be achieved by 20. By 21, 22, you should be out of that realm. And that's why 18, we say adult is 18. 18 is not an arbit number. One day people didn't get up and say कि 18 को adult बना देते हैं, like आज ये decide करते हैं. It is that number. number by which your glands have matured, by which your bones have fused, but it's a specific number. So till you are 18, 19, like everybody comes, even a 40-year-old lady will come to me and say, I have PCOS. I said, you don't have PCOS now. It is a melody of a younger woman. And till you're 20, you can call a polycystic ovarian syndrome. But once you are past your 39, 40, it's your normal cycle. So with males, the androgens androgenic hormones hai, they are acnogenic. So they produce more acne, they produce more hormones. Now what happens is people are having lots of hair fall, males especially. It's not related to acne, but once we are talking, and Deepak has asked this question, when the puberty hits to girls, there is a specific cycle starts. With boys, the androgens go on and the hair loss starts, which people don't even realize. So the boys have high testosterone, and 70 to 22 is the time when there is increased hair loss. And again, testosterone is responsible for acne also. What happens is, to treat that hair loss, then people take lots of medicines. They take anti-testosterone medicine. So that works counteractive, and your acne don't finish by the time you're 21, 22. You don't realize hormonal imbalance is something which is, you have to understand for your age, for your gender, what is the right hormone balance before naming it hormonal imbalance. So that's why if you have acne, I would suggest definitely meet a dermatologist. At least they'll diagnose and tell you what to do.
Of course. So yeah, it is very important to understand what the balance is in order to know if it is an hormonal imbalance.
Exactly. For every age, a balance is different.
Yeah, of course. So because it goes on, it's a continuous cycle.
Exactly.
Another viewer, Dr. Priya Sharma ने हम आपसे पूछा है कि does sweat cause acne?
Yeah. Sweat, when we are sweating, the sweat gland and the sebum gland, they release their products by the same pore. तो sweat और sebum का जो mixture होता है, that irritates the skin, and that's why humidity may you feel that the skin is irritated, and there is a layer on the skin. So that's why in summers and in humid months, to wash your face with a foaming face wash, with a salicylic acid face wash is important, because it removes that layer. Sweating in itself, sweat when it is secreted is sterile. There are no bacteria in it, but if stays in the body, then it becomes infected. So sweat might not cause acne in itself, but if you don't clear the sweat, it might stimulate the gland and cause acne.
And then we're back to that point where it can be an infection and inflammation at the same time.
Exactly.
That's nice. That's nice to know. Dr. Sonia Singh जानना चाह रही हैं, does family history matter for the occurrence of acne?
Definitely. 30% of what we are comes from the family history, and both the parents have to have that. If the parents have oily skin and has had a history of acne, then the chances that their offsprings will have acne is more. The acne is graded from grade 1 to grade 6. So all of us, whatever may be the family history, whether your parents have, we will have acne grade 1 and 2. But if you have a family history, then the chances of getting nodular acne or thick acne in grade 4 and 6 is very high. Secondly, if the parents had suffered acne, they should be very vigilant, because when you were young, maybe the medicines and the facilities were not available, and you still live with those marks which you had at acne. But in 2022, we have enough things available to control the acne, so that the children are not left with any marks or scars post-puberty.
I think this is the level of awareness regarding acne and our skin care in general that everyone should adopt. There is a question by Yogesh Mehra, doctor. He wants to know, what other lifestyle changes would you recommend to keep acne away?
Yeah, one thing which is acnogenic. The word acnogenic means which promotes acne or which induces the gland to produce more sebum. Milk is acnogenic. So if you have a tendency for acne, then milk is something, and in the milk, it is the whey protein. The problem is the whey protein has become a very staple diet constituent of people doing gymming. So they don't even realize that milk has two proteins. One is the whey protein and another is the pea protein. So whey protein is something which induces acne, and it is a big cause of acne in adult male population who are doing gymming. So one thing which we want to avoid is milk, and milk doesn't include milk products like dahi and paneer are not included. It's just the whey protein. Drink more water, 8 to 10 glasses per day, because it dilutes the secretions. Once the secretions are dilute, there is a logic to everything. But I'm not going to randomly say कि ये मत कीजिए, ये मत कीजिए. I'll tell you the logic about it. Thirdly, there are people who are sensitive to certain food products, which can be chocolate, which can be sugar, which can be, most of the people are cheese and wine. But if you feel that you're sensitive to that and your acne increases, don't consume it. It's not a blanket statement that everybody should not take it, but people who are sensitive to it, they will know that it is there. Wash your face. Make it a habit to wash your face the moment you enter your house. Don't touch your face and places where you have acne again and again with your hand. These are simple habit forming changes or habit changing changes. The thing is, people who touch their face don't even realize they're touching their face. So it tell you the people around you that if I touch my face, tell me. So that's the only ways. These are the lifestyle changes which are more important than talking about medicines and, like, creams, unless and until you need it. Everybody will get acne at some stage or other. So if you are taking these style habits, then you won't need the treatment.
Of course. And if we have to, arrive at a treatment somehow, like what treatments will you then recommend for acne?
Yeah, as I said, the treatments depend from grade 1 to grade 6. People who have only grade 1 or 2 acne means occasional acne. Girls get it just 10 days before their cycle. Men, if they're gymming, then they do get it. And I told the areas: upper arms, V of chest, upper back, and face. These are the areas of acne. So according to the stage of the acne, we first of all we recommend only local treatment. Skin ki khoobsurati beauty ye hai ki we can work from outside. So we can just clean. What we'll do is we'll give you the things to clean the skin so that certain sebum is not there. We'll give you a cream so that whatever inflammation, infection has occurred. Again, I'm telling the names so that you are aware. Clindamycin is something you should use regularly. Uske alawa theek nahi hua, then we'll go to the antibiotic cream, which can be mupirocin or fusidic acid. Agar zyada hua, so then we'll give the oral antibiotics. The thing is that same person might need different treatment in different weathers. So in summers or sweat season, you might have more aggravated acne, people who sweat more. Another thing is that you have to understand that hair also is part of the same system. So if you don't wash your hair very regularly, there also you get acne, and we call it dane ho gaye, but hai to wo acne ka hi solution. So अगर आप अपने आप ठीक कर सकते हैं, जब तक आप ठीक कर रहे हैं, वेल एंड गुड. लेकिन अगर 2 हफ्ते, हर चीज की एक मियाद होनी चाहिए, टाइम होना चाहिए. आपने 2 हफ्ते अपने आप किया. आजकल ऑनलाइन इतनी चीजें मिल रही हैं कि एवरीबडी कीप्स ऑन एक्सपेरिमेंटिंग, बट you should have a timeline. Okay, I will use this for 2 weeks. If it doesn't get better, I'll visit a doctor. It's not that कि 2 week ये use किया, फिर 2 week you use किया, फिर वो 2 week you use किया, जब तक डॉक्टर के पास पहुंचे वो उसका सत्यानाश होगा. So be intelligent as an aware consumer. आज आप FB Live देख रहे हो इसलिए because you are interested in the topic. And why am I giving my time to you? Because I don't want you to come to me unless and until you have done your part. So that is more important. And then there are grade 4 and 5 acne, where we do give medicines which are supposed to reduce the oil production. Today we do the peels also, glycolic peels, though we don't do it for a younger population like till 16, 17, 18. We don't want to touch their skin a lot. But if you have adult acne, then we'll do various therapies. As I said, 2022, you're fortunately in an era where there are lots of things available. What is to be done on whom? Only a doctor can decide. You cannot come to me and say, ye kar dijiye. You might not need it. So give the, no, there are people who come and say, peel kar dijiye. I say, kyun kar dijiye? So, you give me the benefit of what I do. I've been practicing for 25 years. I know what I'm doing.
So there is really this important perspective that we need to find, that yes, trial and error is important, exactly, but to a certain extent.
Exactly. It's not indefinite. It's not indefinite.
Of course, obviously. So as we make our way to judicial skincare, we need to be very much aware of what is working for us and when to see a dermatologist, which should be very soon.
Exactly. Even if you go to a general practitioner, basic treatment everybody knows. As an MBBS doctor, as a GP, we have been taught how to do the basic care, and the GP knows how to treat grade 1 or 2 acne. Once it's needed further, they themselves will refer you. So
So
that's,
there, so there we have it.
yeah.
Doctor, there's a question from one of our other viewers, Anand. He's
Hmm.
asking, how should I go about my anti-aging routine when I'm using acne treatment or going through the same?
No, if you're getting acne, then your skin is oily, then you won't need too much of anti-aging treatment. That's the whole thing. Anti-aging is another realm. Anti-aging, at different ages you need different things. When you are younger, in your 20s, you just need to moisturize more so that the pollution and the environmental things don't damage. When you reach your 30s, then you have to use the serums like vitamin C, niacinamide, so that they pump up from inside. When you're in your 40s, then you need collagen based thing. When you're in your 50s, then you need anti-aging, which reduces the wrinkles. Acne treatment means, if you are using, first of all, if you are using an anti-aging treatment, you should use it according to the weather. In summers, use serums. In winters, use creams, because if you use a cream in summers, that in itself will cause acne. And if there are acne, what you should do is, whatever you are using for your acne treatment, use it for half an hour, wash it with water, and then apply your anti-aging serum. I am very interested in knowing what he is using both ways. Definitely send me a message. What I'll do is, I'll do the correct order of things you should do.
Of course. So yeah, that is one way to look at it. डॉक्टर एक्ने के लिए अक्सर क्योंकि जैसे घरेलू उपाय जिनको बोला जाता है उसमें से एलोवेरा इज वन ऑफ द very prominent element present in almost every household. And Yash Namdev, one of our viewers, has the some kind of a same question. And can aloe vera be used to cure acne in teenagers, as he's using the same to get rid of acne?
Yeah. It's not to treat but to control. Aloe vera has anti-inflammatory properties. So the inflammation is controlled by acne, the irritation and all the redness. You definitely can apply aloe vera, but you have to understand that aloe is a gel. So gel you can apply during summers and humid month, but in winters, if you apply aloe gel, it will cause dryness and it will cause flaking. Aloe gel, again, I said, if you have been using aloe gel for 2 weeks, 3 weeks, your skin is fine. I'm okay with it. But if you feel, in spite of aloe gel, the acne is coming, then definitely you need to add on something. So aloe gel is okay in grade 1 and 2 acne, but sometimes you don't realize what kind you have. So there is no harm in using. But again, if you have been using it and still you are getting it, then you need to supplement it. So there is no harm. One thing which I'm very afraid of is that lasan adrak ka paste, and another is toothpaste, which people apply on acne, and it actually burns the skin. Please don't do that, because that burn, to remove those marks are almost impossible for us also. That acne is better than that acne mark.
So because yes, there is due to lots of misinformation.
Yes,
People
because people get a big acne and they have some function, so they'll apply something on there and that leaves a mark. So that's a bigger problem.
My God. Doctor, since like in skincare, sunscreen is touted as a holy grail, as a product of grail. So how should you deal with the sunscreen acne allergy? Can we use customized sunscreen for acne and acne prone skin?
Yeah, sunscreen, you have to divide into physical sunscreens and chemical sunscreens. Normally, people who have reactions or are active acne because of sunscreen are the ones who are using chemical sunscreen. So if you have an allergy to chemical sunscreen, first of all, sunscreens are available in all forms. There is gel, there is cream, there is spray. So you might be using the wrong kind of the material with which is there. So if you feel you are getting acne because of the sunscreen cream, try to go to a gel based cream, try to go to a spray based cream. And again, if you still feel that you are getting, the thing is that sunscreen is a product which is supposed to form a layer on your skin. But because we live in an environment where there is lots of sweating also, so that layer becomes the problem of acne. So then try a physical sunscreen. Physical sunscreen, the best physical sunscreen is calamine lotion. As we talked of aloe gel, which is good to reduce inflammation, calamine lotion is very good to reduce inflammation and form a sunscreen base layer. The problem with calamine lotion is because it is pink, so sometimes it shows on the skin. So what you can do is you can form a better visible. As women, we have the advantage of using the what you call the face hum jo use karte hain, concealers and the so that forms the foundation. That forms, the foundation is a calamine lotion formula. It has the same bentonite is multani mitti. It has the same zinc oxide, and because it is a foundation, it is found in our colors. Today, I was telling one of my male patients, he was having some. I said, don't tell anybody, but start using a foundation because that is the only solution you have. But if you tell people, they'll say, oh, it's makeup, it's makeup. It's not makeup, it's skincare. So if you're getting acne because of sunscreen, first of all, change the level, change it into gel, change it into a spray based sunscreen, and then try and use a physical sunscreen. Physical sunscreen में जो जैसे आप क्रिकेटर्स को देखते हो वो white white नजर आता है, that's a zinc oxide. तो हम ऐसा भी नहीं लगा सकते कि वो नजर भी आता रहे. तो find the calamine lotion, ask your wife or sister or girlfriend to find the right foundation shade for you, and just 2 drops daily will do the job.
That is quite a sound advice, doctor. Like, I must say that too, because skin, as you said in the beginning of this talk, that skin issues, they have a huge impact on our self-esteem and the way we perceive ourselves and how we want to be perceived by others. We have a similar question by Ajit Singh. He's saying, I got acne on regular basis. Please suggest some measures to get rid of that. I am very bad and I feel very low confident.
Ajit, if it is making your confidence low, it's high time you visit a doctor. Yeah. On FB Live, I cannot cure the problem. It has been there for so long. But I can assure you, your problem will be solved. The problem happens is that people want quick result. And acne, there is no quick result. So go to a doctor, stick with the doctor in different seasons. Sardi Garmi Barsat, as I say, that you have to be with me for the problem to be over completely. Don't get disheartened. I can assure you, the acne is something which we can take care of it completely. But as in, in Delhi, it is almost 5 degrees, 6 degrees, then it becomes 45 degrees. So something which works in 45 will not work in 5. So you'll have to be slightly patient, but work on it. Don't let it affect your self-esteem. I don't like something which is so simple to treat. Be such a big botheration in your life.
Of course.
So promise today that you'll go and visit the doctor.
I hope, Ajit, Dr. Shehla's sound words have made some advice to you.
No, just call up a line and fix an appointment with someone.
Doctor, as you spoke about different seasons and different weathers, like how what works in 45 degrees won't work in 5 degrees, of course. Monsoon ki season mein, as we spoke about the need of moisturization in winters, monsoon mein there are certain, there's a peak of occurrence in acne. So are there any certain lifestyle factors or any measures that we can do?
Monsoon, as I said, when we were talking of sweat, the sweat and sebum forms a layer on the skin, and that causes acne. There is a constant irritation of the skin. So in monsoons, again, a gel and foaming face wash is very, very important. The difference between the summer and the monsoon care is that more washing is needed in monsoons, and then you have to start drinking more water. Somehow or the other, in summers, we still drink water, but in monsoons, the water drinking goes down because you don't feel thirsty. So there is one saying that keep yourself hydrated from inside and outside, and things will be clear. And again, then you have to shift to the products which are gel-based products. So in monsoons, definitely go to the product which is gel-based. And today is the zamana of serums. So you can use the serum at night. Monsoon requires you to actively drink water and wash your face, and that will be. समर में क्या होता है ना, अगर आपने ज्यादा वॉश किया और हम लोग एसी में ज्यादा बैठे रहते हैं तो स्किन ड्राई हो जाती है, तो वो फिर भी चल जाता है, पर मॉनसून में अगर आपने वॉश नहीं किया तो दैट विल कॉज मोर इरिटेशन.
And again, फिर जो sebum का irregulation हो जाएगा, that will again, the entire cycle will start again.
Exactly. जो आपने अचीव किया है ना समर में ठीक करके, वो मॉनसून में खत्म हो जाएगा.
The endless pain of acne.
That's why I say ना, acne patients become more frustrated. ठीक हो गया था, फिर हो गया. अरे भाई फिर क्या हो गया? वो आपके ग्लैंड्स मौसम के हिसाब से रिएक्ट कर रहे हैं, तो अब आप आज की केयर सीख लो. So as I always say when patients come to me कि भैया साल भर मेरे साथ रहना है, हर मौसम की केयर सीख के जाओ और फिर उसको करो. So then you will get rid of it. And it's not a lifelong कहानी. आप 1-2 साल सही से मौसम निकाल दो तो the glands will become quiescent. It's not that you have to do it always, but करो तो सही उसे.
Yeah, our body is very good at picking up the habits
Exactly,
and
exactly.
adapting itself into it. So we spoke of dairy products and milk, like एक myth है ये जिसको आपने अभी clear किया कि हाँ,
बिल्कुल.
milk can sometimes be
Milk
uh,
is milk is definitely acnogenic. If you have acne, if you have a tendency, if your parents had acne. I have one daughter. Now she's 23. I stopped milk from since she was 9 years old. Milk is something. अगर हमें milk चाहिए होता ना तो nature would have produced milk for us in some way. We don't need the cow's milk. When we were born, our genes were not programmed for cows and goats milk. It's more of like, social norms and things like that. It's not a necessary food. And whey protein, as I'm again saying, it's not the milk, the whey protein. Because milk तो खत्म हो जाता है, लोग milk पीना छोड़ देते हैं, पर वो जो protein powder घोल घोल के पीते हैं, that causes an issue.
especially the gym going people
Gym
who are
going
very
people,
much into
gym
their
going
muscle
people.
building.
Exactly, exactly.
They forget. So we have one question related to that, related to dietary intake. Advik Singh is asking, I heard greasy food like pizza can make me break out. Is this true?
Yeah.
What I eat, can it cause breakouts, as I'm very much attached to junk food? Advik, who isn't?
No, the thing is, all the parents who come to me, all the teenager parents, the first thing they are signaling me sitting and they ask them to not eat junk food. I'm only going to give you advice which matters in the treatment. I'm not going to do the parenting for you. So the good news is that what you eat doesn't come out from your pores.
Oh, okay. Big relief to Advik Singh and all of us.
Yeah. So junk food, it might reduce your immunity or anything, but it's not going to cause acne. As I said, that people are allergic to specific things. There are people who will be saying, when I eat momos, I get acne. There will be people who will be saying, when I eat sweets, I get acne. When I eat chocolates, then listen to your body. Then don't eat that thing. It's not a blanket statement that don't eat fries, don't eat pizza, don't eat this. No. If you feel that every time, first of all, your skin has to be clear before you start blaming another food.
Yes.
So first clear the skin. Then I always say this is called a food diary. When you break out into an acne, just sit and think, what did you eat in past 40 hours, 48 hours? Because if I ask you today, परसों क्या खाया था आपको नहीं याद होगा, पर आप बैठ के और उसको फिर the practical advice is कि फ्रिज के ऊपर एक पेन पेपर लगा होता है. If you get acne and you sit and think, oh, what did I eat? Then next time you note it down. That's how you will know what is causing the thing. It's not an arbit thing. So yes, I'm not saying no to junk food. Health wise तुम्हें भी पता है, जो खा रहा है उसको भी पता है क्या गलत है क्या सही है. मेरी तरफ से एक्ने के लिए उसमें कोई मनाही ऐसी नहीं है. If you feel something is specially causing stimulation, एक्चुअली जो चीजें हैं वो प्रिजर्वेटिव्स होती हैं. जैसे टोमेटो केचप है, जो सॉसेस है, उसमें जो प्रिजर्वेटिव्स हैं, दे कॉज मोर इरिटेशन देन द फूड इटसेल्फ. सो ट्राई एंड एलिमिनेट जितनी भी प्रिजर्वेटिव वाली चीज है. फ्रेश खा रहे हो, कोशिश करो अपनी फूड, अपनी बॉडी और फूड का रिलेशन ओनली यू कैन.
And there उसमें एक certain extent of vigilance की जरूरत है, because
जरूरत है. अगर आपको एक्ने हो रहा है, देखो टीनेजर्स को हम फिर भी माफ कर देते हैं कि आपकी उम्र है, एक्ने हो रहा है, पर अडल्ट एज में अगर आपको एक्ने हो रहा है तो आपको विजिलेंस करनी पड़ेगी. एंड यू हैव टू फाइंड आउट व्हाट इज कॉजिंग इट. आई कैन नॉट से कि ये एक्ने इस वजह से हो रहा है. सो देयर द जंक फूड थिंग कम्स, बट अदरवाइज ऐसा कुछ नहीं.
And doctor, is stress and sleep, are they also related to acne breakouts?
Stress, definitely. What stress does, stress आपको कुछ एक्टिवली कुछ नहीं कर रहा है, वो आपकी हीलिंग पावर कम कर देता है. So whatever the body takes care on itself, thousands of things keep on happening. After COVID, we are seeing so many things. Why we are seeing so many things? Because our immunity has gone down. So, and these days we are stressing on antioxidants, we are stressing on multivitamins. And fortunately, in Indian community, in Indian people, the COVID was not that bad because we have a gut immunity. We have a good immunity. So when stress, what it does is it reduces your healing power. Because stress produces free radicals which roam around in your blood, for which we give antioxidant. So if you're constantly stressed, your healing power is less. Something as small acne comes, it will be go down on itself. But because you are stressed, because your dopamine levels are very high, it will not go down on itself. Sleep as such it does not have any direct relation. But again, if you're not sleeping, and sleep doesn't mean that it has to be 10 बजे सो जाओ, रात को 6 बजे उठ जाओ. नहीं, it's 6 hours sleep, good sleep whenever you get. Like everybody is a night owl. I am a night owl. So I'm not going to say sleep at 10 o'clock and 11 o'clock. As long as you have your quota of sleep, so your body is not stressed. You don't realize it that whenever there is any deficit, it can be of sleep, it can be of food, it can be of water. The body tries to send signals and then tries to correct on itself. And this autocorrect sometimes can lead to situations which normally you won't have. So as long as you feel कि there is a deficit, अगर आप उसका ध्यान दे दो वो ठीक हो जाएगा. तो stress definitely, स्ट्रेस को दूर करने का, आजकल तो ट्रैफिक में खड़ा होना स्ट्रेस है, so you cannot eliminate stress. So you should have 10 minutes. I'm telling you something which is very basic. Just close your eyes, sit and not think anything. Those 10 minutes will release the positive hormones in your body and will neutralize the free radicals. This is a very scientific point I'm keeping. It's not some hocus pocus or yoga or anything. You need to quench. The scientific word is quench the free radical. उसमें जो माइनस का वो जो खाली लेके घूम रहा है, जो आपके वेरियस ऑर्गन्स पे जाके नुकसान कर रहा है, आप वो पॉजिटिव हार्मोन से उस फ्री रेडिकल को क्वेंच कर दो, वो ठीक हो जाएगा and nothing will be wrong with your body.
And I think all of us, not even a single exception is there. I think all of us, we can benefit from this 10-minute routine.
Exactly.
Like, the kind of life we're living.
हाँ, मतलब you know it's a, अब 24 घंटे टीवी है, सब कुछ. मैं ये थोड़ी बोलूंगी 10 बजे लाइट बंद करके सो जाओ, पर कम से कम जब उठे हो उसको नॉर्मल कर लो. मतलब these are lifestyle. Skin care, hair care, you have to understand, is a life care science, lifestyle science. It's not 5 दिन की antibiotic दे दी. It's not a fever. I as a dermatologist work on Saturday Sundays because most of my patients come on Saturday Sunday because it's a non-emergency branch. So you're not going to take an off, but you are going to be stressed about it. So when you are stressed, then the healing reduces. So these are small things which you have to do to have a clear skin.
Dr. Shehla, your words have been very encouraging, very enlightening, and you as a speaker in our live session, it has been really fun to have you here, such a jovial medical expert with us. We thank you so much for your valuable time.
My pleasure. And I always believe if after this session, even one person, if takes my advice, uses the face wash, uses an oil-free moisturizer, use aloe gel, but if the acne comes, then use an antibiotic cream, our job is done.
that is I think that is the true spirit of somebody who's looking for the general welfare. And we've just been told that we had a large number of viewers watching this live talk, so I'm damn sure that people are going to get inspired by this. Definitely. We thank you a lot for your time, and we look forward to many such sessions with you.
Thank you so much.
And
have a good new year. Have a blessed life. Increase your immunity. Acne will not trouble you.
That's so sweet of you. Thank you so much, Doctor. We also wish you a great Christmas and a Happy New Year. And we thank our viewers and the live audience too. Thank you so much for joining us. We wish that you have a great day ahead. Thank you so much.
Today, one of my patients was complaining. There were lots of patients. Ma'am, baat bahut karti hai. I said, baat hi karne ka value hai.
Actually, that is the thing. That's what, like, being a doctor, I think baat karna is the necessity.
And skin में खासकर, skin में 4 दवा से काम नहीं चलेगा. जब तक आप अपनी आदतें नहीं बदलोगे, मैं कुछ नहीं कर सकती.
और वो बात करके ही बदली जाएंगी.
Exactly. Take care, beta. Pleasure. Bye.
Thank you so much, ma'am. All right.